Hello everyone and welcome to another slightly later than usual Charity Digital webinar. I'm Chris Hall, Head of Marketing at Charity Digital, and I'll be your gracious host for today's proceedings. It's actually been a while since I've been here chatting to you. I really hope you're all keeping well. And that you've actually managed to get yourself some well-deserved time off. Let's get things started in the chat. Let us know where you've been, or anywhere sunny, anywhere exotic, might just be local, but let us know where you've been able to get some well-earned time off too, or if you haven't quite gone yet, let us know where you're going. I'm about 28 hours away, but who's counting away from one whole week off, and I really can't wait. Although I'm not really going anywhere fancy, unlike a lot of you, who I'm sure you will be sharing in the chat in a bit, but I've just moved to Bedfordshire, and I've just adopted a dog. So me and the pup are going to have a bit of a lads week exploring the local doggy hagouts, and probably a few of Bedfordshire's pubs as well, I'm sure. We've actually got a cracking session lined up for you today. And yes, there's a COVID angle, but it really is a powerful one. Today is all about learning from the data COVID has been providing us and really using that to empower us and drive us forward. I think we put in the initial sort of blurb for the webinar that data really does tell a story, and that's true. It provides a narrative and really does give us the most accurate depiction of our past, present, and future. It does show us the lessons that we should take from the past, and the changes that we should make in the present that will ultimately help us change and give us new direction that we should carry into the future. And overall, sort of understanding data allows us as charities and non-profits organisations to change our journey in real time, and not just continue surviving, but keep thriving in a post-pandemic world as well. And we've partnered with the keepers of the .org domain public interest registry for today's webinar. And we also have an incredible speaker for you as well from Imperial Health Charity. But before I introduce him, I'm just going to run through a very quick reminder of the house rules. First of all, we have a Q&A at the end of every webinar. So it's about 35-40 minutes of presentation, and it will be myself and Oliver to run through the Q&A as well. You can submit questions by hitting the Q&A button, sort of the bottom right. It looks like two speech bubbles overlapping each other, and you can add your question in there. You can also upvote questions now, so if there's a particular one you like above the others, make sure to hit the thumbs up, and that'll guarantee it gets asked above others. So really important to do that as well. Sessions are also recorded and slides are made available after the fact as well. We tend to send all recordings, slides, and any resources that are talked about within a week of the webinar finish. So you can have to sit tight and keep an eye on the emails for those. Closed caption is also available. So if you require that, it's just on the right of the Q&A. For me, it might be slightly different if you're on a mobile phone, but just hit that, turn those on, and you'll be able to understand my accent a little bit better. And finally, use the chat. These webinars are all about you. So if you've got something to share, you've got a story to tell of your own, you've got processes and stories and anything you have to share, tidbits for other members of the webinar today, please do share them. It's the real value out of these webinars. I think the fact that we not only learn from the speakers, but we learn from each other as well. So don't be afraid to use that. And that's it. So let's get started. Please give a virtual round of applause for Oliver Carrington, the Evaluation Manager at Imperial Health Charity. Oliver, huge thank you for joining us today. Take us away.
Yeah, hi everyone. So before I go into who I am, I'd like to start with a mentee just to kind of find out a bit more about who's here. It's great to see so many of you. So I'll just share my screen. Yeah, so Menti, I'm sure lots of you have done it before, but just open up another web page, or you can go on your phone, go to menti.com. The instructions are just at the top, and then just write in 44613319. And then it will come up with this question really, and then we can start seeing who's here. Great, so someone's got through. So who's in the room today? Are you from like a largish charity or social organization, a smaller one? Any funders or government in the room? You're very welcome. or anyone else who doesn't kind of fit that description. Everyone's welcome today. Great, and this is kind of a nice sort of way to think about data already, sort of seeing kind of this live data come in, a bit of data visualization, a way for you to kind of feed back in, kind of nice way to set the session really. So great, I'm going to kind of move on. So we've got quite a lot of smallish charities, as we kind of know from data, that most charities are small charities, so not really a surprise there. And then this one's about how confident you are on the topic of data. So which animal do you identify with most here? Someone feels a bit grumpy when the data topic comes up. That's completely understandable. Confused, yeah, I think that one might get bigger. Genius, oh, great to see some of you in the room. Superhero, so I guess that's got everything sorted. And sleepy, yeah, like maybe it's been on your to-do list to learn more about how your charity can do more with data. Yeah, so confused, Al, I expected that one to be the top. And you're probably doing a lot more with data than you think, or at least collecting a lot of data, and you might not sort of see it in that way. But yeah, let's see what we can do in the session. And then finally, I just thought this one might be a good way to collect some sort of learning from any of us, because there's a lot of experts in the room, I imagine. So what data tools would you recommend others to try? So just put in as many as you like, and then this will be available later on. And there might be some good things to try and Google. I'm going to Google some of these. Might be like Tableau, or yeah, Power BI's come up, some maybe data visualization software, Data Wrapper. That's one of my favorites for sure, and I'll be showing a little bit of that later. How about anything for analyzing data? Even the simple things, yeah, Excel, yeah, good to see trusty Excel come up. Great, yeah, so keep adding anything in. If obviously this is word cloud, so if someone's used more than one, it'll get bigger. And yeah, I'm going to leave this now, but feel free to add in more, and we'll come back to it at the end. Yeah, so here we are. And yep, my name's Oliver. I'm the evaluation manager at Imperial Health Charity. So we're a charity of about 35 people. So not that big, but supporting 5 London hospitals through grant making, art, volunteering, and fundraising. And I previously worked at NPC, Prince's Trust, and for some funders. So let's start simple. For those confused owls, numbers. So what is data? Numbers, statements, or characters in a raw form, either quantitative or qualitative. It is meaningless until it's interpreted by a human or a machine. So yeah, it's all around us. It doesn't have to be in a computer, but kind of once it is processed or interpreted, it turns from data into information. And then it still needs to turn into wisdom for us to kind of use it to improve or to get the best use out of it. And then there's 2 big words in there. I'm sure a lot of you know it already, but quantitative is all about numbers. So for example, this table I'm on, I think it costs about £100. I guess it's about 1 meter high. So kind of all these things which can be expressed in numbers. Qualitative, so that's kind of descriptive data. So I might say that it reminds me of my grandma's table. It's wooden, it looks like that from my childhood. This kind of stuff which couldn't really be shown in numbers. And yeah, so and where might charities use data? So here's just a few ways. So could be used for planning, for risk analysis, so for forecasting, for example, in like budgets and realistic targets. In your service delivery, so you already would be collecting a lot of data if you're a charity, people's information, what's been achieved, that kind of thing. So how many units you've put out, how many people have attended, and this is to help you kind of monitor what you're doing and to hopefully make those processes a bit smoother. Volunteer management. So a couple of ways you could use data here is to encourage recruitment. So you could use results from a survey to encourage people to come, or help explain kind of what their role is, how many people they might see on a volunteering session, help build morale. Impact reporting, so this is a big one here and is my key area. So this is all about learning insights and communicating success. And then one which we're always very interested in is fundraising. So providing your detailed reporting using data to go along with some of those stories and photos, which are also very good. But also using it to learn more about who's giving the money. That's kind of a big area in data with charities, especially the bigger charities. So getting donor insights to try and better engagement. So like who opens your emails, what kind of person gives the most money, what is all those kind of donor patterns to help you kind of learn and target and improve. And then a little bit more focus on impact reporting, because that's my background. Here's something which is called the 5 types of data, which is gained a lot of traction in the last couple of years. Something NPC put out, and there's a link down there for you to check out later. This is kind of looking at, there is data, but what kind of main groupings are there? So here, user data. So this is really the characteristics of the people. So before you've done anything to them, before you've involved them in your service. So kind of the gender, the age, it might be how big their income is if you're thinking about fundraising. It might be something that you coded them and put into a group yourself. Engagement data, so this is kind of how often they've interacted with you. So that might be how many times they've contacted you, how many times they've attended a session, all pretty useful information to connect to that first type. And then finally, letting these people have a say. So what kind of feedback are you receiving back? So this could be descriptive, qualitative in like a comment, or it could be quantitative, in a survey. They might have selected 50% selected strongly agree to this, and that's a number in that sense. Outcomes data. So this is what we focus a lot on, what we're really interested in. So there's short-term changes or there's benefits gained. So think about increased confidence, these kind of things, which are mostly kind of covered by surveys. And then finally, impact data. So this is the long-term difference. And this is something which is quite advanced and not something normally for charities to focus on. This is things you kind of would need to be very robust and have a control group. And this is probably a bit too much for a lot of our charities, but that's kind of the five main types. Yeah, so now we've kind of sort of dealt with data and up to speed on kind of what we mean by data and how that kind of can be used in the charity sector. Let's kind of talk about the past. If you're thinking about pre-COVID and post-COVID, even though we're still obviously in a COVID world. So there's a lot of good things. Obviously, we're not coming from nowhere. The charity sector has improved a lot when you think about data. So here's the good. I'm going to think about the good, the bad, and the ugly. So we've got more specialists, people like me, which I'm pleased to put in there. A lot of planning for data. So things like theory of change. That you can't just collect data and expect it all to go well. You should be really targeted and focused on what you do. Number 2, more social organizations are now collecting data, which is great. People have surveys, people count their data and record it. Yeah, so the third one is about storing data. So lots more people are having databases, especially recently, and using a lot more technology with their data. So data viz software, Tableau is becoming big. And then more using it as well. So not just collecting it. I think sometimes we're guilty of that and not using it. And then also sharing it. So a lot of us know about 360 giving. So that's where funders have been recording their grants data in the same template and then sharing it in a public standardized form. So that's some of the really good things which have been happening. Now let's go on to the bad and the ugly of what I hope is in the past. So we have, even though we've got more specialists and planning for data, there's still quite a version here really of maybe it's quite far down the list. And that's understandable in a lot of ways. Few have capacity and resources to kind of do this properly, but I'm hoping it'd be prioritized, that there could be more funding available for that as this gets more in our sites. And the next one. Cool. So more collecting data, but a lot of this is paper-based, which isn't very efficient. Sometimes it will need to be paper-based and then transcribed, but we'd like to see less of this, I think, going forward as people get more used to collecting stuff, using their phones, using tablets, using computers. Obviously, it won't be for every age range, but I think more of this, more online is going to be the better for us in terms of data. And some of us collect too little, and some of us collect too much data, asking too many questions, storing too much information, which is not used. And then spreadsheets still rule the world, I feel, in the charity sector, which is okay if you're a small organization or if you're very targeted in what you do. But I don't think that's the case always. We have lots of spreadsheets. It's confusing. Where are they? Where do they live? Even when we have databases, it can cause a lot of headaches. Can put a lot of effort to set up, and a lot of times they don't talk to other parts, or there's parts we don't use as well. And then my final bad and ugly thing is that so we might be using and sharing the data, but many are still not analyzing it. I think there's probably a lot of surveys out there, so easy to set up a survey, but it's quite hard to put in the time to analyze it and get some true learning insights out, which will lead to decision making, other than something kind of flashy to put in our impact report or on our website. So here we're with the present, or hopefully ending present. So thinking about how COVID has affected data. So it really disrupted our relationship with data in charities and as a whole, as well as a lot of other things, obviously. So thinking about my organization, my charity. So initially, we did a lot of emergency responses. So we changed a lot what we did. A lot of the data processes that I had set up and put a lot of thought into were just not sort of realistic. We had to kind of cut corners. We had to adapt. We had to try new things out, and that's completely understandable. And I kind of had to play catch up instead of trying to kind of do too much planning at the start. But at the same time, it was also, I knew it was still very important collecting data and understanding that data, even though we were doing lots of really fast-paced things, because I knew we had to report back at the end, but also it was a great period to kind of learn what was working as we pilot new things. Yeah, and sort of traditional and paper-based methods for collecting story data that we still did quite a lot, had to be digitized at like a fast pace. And we had some ups and downs in that. Things like, we had some free text options in some of the data we collected, which just caused a big headache for us at the end. And it was kind of hard to know those things would cause a problem until it happened, really. And then a final one there, this is kind of more general. So the public has become way more data savvy. So for example, on COVID-19 data, we all kept really abreast of it, I feel. Most of us did. We all went on those websites, what was happening. We kind of needed to understand it because there was a lot of misinformation going out there. We wanted to see like how many cases are in our area, how does our country compare to other ones. We understood data in a way we never have done before, really. And a good example was in data viz, which is one of my passions. This is from the Financial Times, where it's quite a complicated chart, but it was one that was kind of seen and shared a lot on Twitter. And we saw things like this on our TV screens all the time. So this one has a number of days since the 10th death at the bottom. And And then on the side, we have the number of deaths using a log scale, which is kind of a very math brain kind of way to do things. But the public kind of really got used to understanding this kind of information. Same for this one by the same person, John Murdoch, who's a great person to follow on Twitter if you aren't already. But here was kind of showing the vaccine effect early on, really. So here, John took sort of the data on patient numbers for those aged 70 plus, who you'd assume most were vaccinated, and those who are younger, and sort of seeing kind of those cases after that happened. And you can really kind of explain that this green area is showing that it was working. Even at the start, it looked a bit confusing because patient numbers were still kind of going up. Yeah, so looking into the future now. So this is kind of, I guess, the key thing we're quite interested now, really. So I kind of wanted to sort of like look at some of these data solutions that we're seeing more as we go into the future, and more technology and new ways of working are really helping us with. So those data solutions to the bad and the ugly that we saw before. So there's a lot more data being published out of there. Like I already mentioned pre-60 giving, but there's a lot more. Like I found me working for a hospital charity, I hadn't really kind of interacted with all the amazing NHS data which is out there from NHS England. So for example, I didn't have to wait to talk to my contacts in the hospital. I could download this from their website and produce like weekly charts for our senior management team to understand which parts of our hospital are getting really busy, how did that compare to other hospitals. So we kind of knew where our services were needed best in supporting staff and patients. And here's an example as well. So, and I think this is a really quick win for any small organizations out here, particularly who might be collecting postcode data already as part of their participants in their services. So you can take postcodes, you can go on this this really cute website from DataKind. So plot all your postcodes in here, click a button, and then you get this map of where they all are, but also using their data from the indices of multiple deprivation, and it kind of gives you an understanding of where they kind of fit in the UK, from most deprived areas to least deprived areas. It won't obviously know about the person themselves, but the area that they live in, very small areas. So if you wanted to learn a bit more about your people without having to ask another question or personal questions about their financial income, things like that, you can use this kind of data. So it's just sort of showing that there's a lot of kind of things out there to help, and a lot of things you might have not thought about, even though you're kind of collecting that data. Yeah, and so much like free, low cost funded or funded data training out there. So here's just a few here. And NPC, where I used to work, I know they do bursaries for small organizations to go on their sort of theory of change courses, things like that, and their data courses. Lots out there. So and do feel free to put some in the chat if you've got had any good experiences there. And free data storage options. So the cloud's becoming a big thing. Like we should all know about that now. And here's something I saw recently at the Data for Good conference, the Airtable database. So do have a look at that if you haven't got a database already. It's a free option. And it's a good start, rather than, because a lot of databases can be really expensive, even though they might be really useful as well. And then thinking about what you do with your data. So there's a lot of sort of free software out there. So I've recently started using Tableau, the paid version, but they have a public version. Just something to know with the public versions of a lot of these things, the data is kind of public, so you just make sure it's safe and not connected to a person. But loads of, especially data viz software, they've kind of exploded. So it's all on web-based normally. So Data Wrapper is one I really like, and there's some kind of data analysts examples in there. And please do still add some more stuff to your Menti if you have any more ideas that we'll share later. And here's an example of what I did with sort of data wrapper. So for my charity, we were kind of showing, when were those peaks in our specific hospitals that we were looking after. Here is kind of just a table. Tables are really good too and easy to make in software like this, which are a bit like a kind of added to a normal table that you might see in Excel or in Word. You can kind of use a lot of graphic kind of techniques in here as well, and color coding to kind of see where we were compared to others. This is an example of comparing survey data. So we do surveys of our staff at the NHS staff. Here's another example. And here's some stuff from my own sort of my hobbies in data viz. So here's a choropath map, and here's a dumbbell plot. So lots you can do with data viz software out there. Have a play. It's mostly free. And then finally, pro bono support. So things like DataKind, Statistics for Society, putting an ad on Reach, which looks for trustees, but also for kind of experts in data or whatever, in comms, marketing, lots of other things as well. I'd say with some of this stuff, you kind of should have your sort of data in a bit of order first to kind of get the most out of it, and have kind of a problem you want to solve, which kind of makes it a bit more useful rather than throwing all your data at someone who's doing it for pro bono. And then sharing your data. So I think a lot of us are getting a bit less scared and sharing our data, kind of know what kind of data we can share, which is appropriate, and what could be used by others to improve them or for us to kind of benchmark against. And if we get time at the end, I'll talk a little bit more about a shared measurement project that my charity was involved in. And here's an example from Street League on that last point. So this is on their website. They have an interactive impact dashboard, like from this, like such great data leaders for our charity sector. The young people, the funders, anyone interested can go on their website and get some of this live data from their dashboard. And now thinking about kind of hot data trends for charities in the future, I think we could learn a lot from a lot of companies. Citymapper is kind of the really obvious one here. So a lot of us use Citymapper, at least now we're going back to the offices, and Citymapper used a lot of publicly available information to create a service for us, which has become really useful for us. On top of that, then they're really savvy with their data, kind of knowing which are the kind of the underused routes. They created their own sort of bus system, kind of thinking about where people are trying to get to, where are those kind of gaps in the services. So there's probably a lot you can find out about them online to inspire you as well. And I put Spotify in here. Like, we all love receiving our annual kind of stats from the year. It kind of really engages us, creates discussion. This is probably good from a sort of like a fundraising perspective, like using people's data you might be collecting and spitting it out and making something more from it, really. They also use algorithms to find other music which might be similar. I'm not saying we do that in the charity sector, but kind of using that kind of thinking, really. Yeah, so the hot data trends for charities in the future. So big data, like getting all your data in a usable format, putting it all together, being able to kind of compare it. A lot of us deal with lots of different small data, so lots of different like spreadsheets. We want to kind of be able to, you want to have everything at your fingertips, really. And dashboards are really good for that. So that's something I'm doing at my charity, trying to get our Tableau dashboards going. So everyone in the charity can kind of access to this really like useful data about our impact, about our grants, about what we're doing, about the hospitals we work with. Real-time analytics and predictive analytics. So this is algorithms. It'd be great if more charities could crack how to do this to kind of help, if we're a young people charity, what's working for people, what's working for specific people, what can we suggest, can we be useful in that way. Or I haven't put in chatbots. So I know a lot of organizations are doing this, of finding a way to like give advice or provide support. And like we've all used them on customer service things. Sometimes they could be a bit frustrating, but a way of kind of using that to help get support where maybe there wouldn't be a person available because we're charities. Blockchain, a little bit complicated this one, but it's all about transparency in your donations and keeping it secure. And you can read a lot on that as well if you on Google. Machine learning and artificial intelligence will collect lots of data, or for example, in the funding world where there's a lot of applications, they should be kind of reduced where possible, but it's kind of one way to kind of maybe learn more about the people applying, filter things out. I think in New Zealand, there was like a pilot where they had medical research grants, and they selected them using technology. I think it caused a bit of controversy as well. But with all these things, you've got to be aware of all the ethical issues, but also what was good out of it and how can we move on, how can we make that better and get past those kind of issues. Just check the time. So I've just got a little bit more. I'll just quickly talk about these last two, shared measurement and data visualization, how we can use it more. So my charity and 9 others NHS charities decided to do some sort of shared measurement together. So with the help from NBC as well, and Inspiring Impact, we created a shared theory of change. We then used that to create our shared surveys and made sure we collected the same kind of data to do a pilot. Then we kind of made sure that we were analyzing it in the same way, so then we can compare it. And it was a really useful kind of pilot to see what could be possible with perhaps more NHS charities, and that's something we're going to be looking for the future. If you're interested, we've got a short report out there. If you're ever interested in doing that with any other similar organizations. For us, we were kind of thinking we're not very competitive, but we always act in isolation, even though we do very similar things. So it was just a great sort of learning experience, kind of thinking, oh, how come, it's a chart, for example, how come do you do much better in this particular survey question about improving well-being? What are you doing? What can we learn from that? And then in data viz, just very briefly, here are my top tips. So when you've got your data, you've cleaned it, what you should do is let that data guide you. So use credible data, spot patterns. You might have it in an Excel spreadsheet to start with. Put your conditioning on, seeing where those kind of there's color conditioning. So you can put red for a low, green for high, and see where are those kind of patterns that you might develop a story from. You might want to add extra things, like think about averages, the differences, or groupings to try and create more interesting data visualization, or one that create more insights. Decide on your audience and find a story, the really important one here. So have a research question that you want to answer with your data visualization, your chart, your graph, or whatever. Sketch out some stuff freely, and make sure you use the appropriate charts for the data. So for example, pie charts use it quite a lot, but they're showing a proportion of the whole. You wouldn't be able to kind of add multiple things up in there. And there's a lot of guidance out there to help with those kind of ideas. And then finally, keep your design clean and simple. Think about accessibility, make it deliberate, justifiable, and explainable. And I really think a lot of charities need to step on this and do more data visualization. I go through lots of reports and very text heavy. It's kind of hard to see the meaning when we're very time poor nowadays. And I think data viz can really help there. And with the public, with our trustees, with our the people we support, a nice way to communicate to them. So I'm going to show a bad one to show that anyone can even use Excel to create a good one. So here, this is a bad chart. there's kind of a lot going on. It's a bit misleading, and it's kind of hard to know straight away your techniques. This one, for example, is about grant expenditure by category. So the first thing I do there is to take away the 3D. So 3D charts are misleading. It's kind of hard to kind of carry along the line to find out how much that actually is. I don't know if you saw it, but the y-axis was not at 0, which does happen a lot. That's okay in a line chart because you're looking at the kind of the trend rather than the total numbers. But here it's a no-no. Oh, and then, yeah, so that's just a little joke there. And then I've sort of deleted any chart chunks. So it's so much clearer already. Sometimes those lines are necessary. In this case, it wasn't. Also got rid of like the duplicated key. And this one I've labeled directly because I felt this is what my audience, they just want to look at that. They don't want to try and find out what they are. I've swapped around horizontal bars to fit in those longer names, so we didn't have to have that kind of diagonal kind of effect. I've reduced the gap on Excel to make it look less Excel-y. So try go beyond their like custom settings. I've ordered by size to kind of help the reader. So someone knows who's the smallest, who's the biggest expenditure category. And then it had lots of rainbow colors, and I like rainbows, but it should be used randomly. So use it deliberately. So for example, I want to point out mental health, that's the one I'll color and use the rest the same. And then finally retitle it for key message. So if I wanted to say about mental health being the third biggest, that's what I should put in the heading instead of just saying grant expenditure. And that's where we started. That's where I ended. So I hope that's an improvement. Yeah, and returning to Chris and seeing kind of if you had any questions. And if you can't think of anything now, you always feel free to reach out. You can find me on Twitter. There's my LinkedIn, and you can email me too. Happy to hear from anyone.
Amazing. Thank you very much, Oliver. Very insightful. No, thanks very much for walking through it. I really like that example at the end. I'm sure many, if not all of us on the webinar today have been a victim from poor Excel reporting. I really like what you said about Spotify as well. Spotify were huge. There were huge impact me sort of early doors on what they were doing from a data perspective. I remember the first time, I think it was back in like early sort of 2010s when they did the first big billboard advertising set with all user data. And I'll never forget this. It was, I used to work and live in New York. I remember walking up 38th Street, a massive billboard on the corner just before the office. And it was to the guy who listened to Justin Bieber's Sorry 3,180 times, what did you do?
Oh, yeah.
I thought it was like just the best thing. I thought it was the best use of user data for marketing that I've ever seen, and I've tried to channel it into everything I've done. And that had about 10 or 15 different ones of this, and then they've obviously went from strength to strength to strength from there with other various things in the way they market in your year in review and stuff, which is really good as well. But I think there's a lot of good to learn from that sort of stuff. There's also a lot of bad, but all learnings there nonetheless. But yeah, thanks for that. Don't forget, if you do want to get a question in, now is the time. We've got about 20 minutes or as long as the questions last to get a question in. You can hit the Q&A button bottom right of the sort of Zoom screen and get them submitted in there. If you have popped in a question in the chat, make sure you carry over, and don't forget to upvote ones that you want to get answered as well. It's more flooding. So without further ado, we'll dive into some of the questions, Oliver, if that's all right. The first one that the first few that seem to be vying it out for the top spot at the minute. I'll go with the one that's there. What are some of, obviously you finished on data visualization, feedback reporting. What are some of those interesting ways that we can share all the amazing impact that we drive as charities and organizations on social media?
Yeah, so like social media gives us a lot of data. That's kind of how they're set up because they want that data as well. So you can either get, you can look at your own data. I look at my own Twitter stats. I love stats from the analytics bit, for example, and I'm sure the others have very similar things. I think if you have like a company as well, like you have extra stats as well. You can also kind of apply for data from Twitter. For example, me and my partner recently did this on collecting how many followers are for drag queens on Twitter. We're big fans of RuPaul's Drag Race. We're sort of creating something at the moment, trying to like see who's the most popular one, because and has that changed after a series or a certain episode.
Yeah.
So that's just kind of a fun way, but there is kind of a lot of data in there, and you can, you know, like you also get a lot of good comments as well. So it's really good to make sure that you are using that. And then I guess trying to, for example, so my comms team are really interested in making sure that we're reaching people. So we draw this data down and make some reports for our trustees, trying to on the different kind of social media, but also like our website data, you know, Google Analytics. I'm sure a lot of people are using that already. And you can also use that if you do the Google ads and stuff and see like if you get much more flow. So yeah, I hope that kind of helped some ideas.
Yeah, I think there's 2 points on that. I think like there's a really interesting data point. I feel like a lot of the big tech companies have been looking at for a few years, and it's starting to make its way into the charity sector now, which is sentiment. Specifically from a campaigning charity, or you know, someone who's very publicly facing, understanding how your audience are talking about you is something that's really important. A little bit more difficult to implement, I think, at the minute. I think Hootsuite has a sentiment tracker. There's other sentiment trackers out there, but yeah, it's been one that's been touted as the next best thing for the last few years, which I think has been a good one to start looking. You can do this globally without having all the platforms. You can kind of just get a sense of whether something's positive, negative, or neutral, and kind of go from there. I think the other point to that was making sure you're taking all that amazing impact and putting in a really high visual way on social media as well. As you know, we know what our audience is like out there, and I think that's the first port of call. Understand what type of content resonates with them, and then turn your impact into that type of content. So whether it's a huge infographic, we're doing something similar, and people on the call might have noticed this with fundraising at the minute. We're trying to find out challenges. We are actually using Mentimeter to get a nice little sort of word cloud of what the biggest challenges around fundraising are in the sector. That's a really shareable thing on social for us in terms of what we're finding from the sector. But you know, if you've got the budget, video is also really good. You know, animated video to explain things again in a very graphical format. If you haven't, just have some fun with Canva.
Yeah, I feel like if you're sharing, like if you do database, if you know your audience, so social media, people like to skip down quite fast, and that's kind of useful kind of way to think. I need to prioritize really quick things where maybe a report would be quite different. Animations work really well on social media because it moves and people stop and be like, what's happening here? You know, bar chart races, things like that.
Yeah, exactly. All those stuff, but it's right. It might be a case of drip feeding as well, like you said, because people do move at the speed of light on anything they can scroll on. So one big stat at a time that connects to something bigger. Absolutely. So next question, do you recommend any introduction courses for someone interested in data analysis and visualization, even for someone who isn't an Excel expert?
So our organization have used this organization called Happy. So other people have done Excel courses on that and found that really useful. And a lot of people self-learn as well. Obviously, you can find a lot of stuff online. Basically, every time I kind of forget how to do something in Excel quite a lot of times, but I know it exists. That's the most important thing. Saying like, I know I can create a pivot table, but how do I do that? Sometimes you might forget. It's pretty normal. So there's so many stuff to Google to kind of help with those videos, or it might be step-by-step guides. Happy is one thing to look. If for more advanced sort of data stuff, what are they called? What are they called? They do it with, I've forgotten them, but I'll add them to this. I've gone on some of their courses and really good. It's like the proper sort of social data course, for surveys, for data analysis, for using more advanced software like PSPP.
No, don't worry about it now. We'll think you've had enough to think about for the last sort of 45 minutes, so we'll get it off you at a later date and make sure we share it afterwards. Totally shameless plug, but Charity Digital, we have on our exchange program, we actually have an Excel course as well, which just focuses on some data analysis. So get over there and have a look if you want to get started anyway. That's a really good place to start, I think. We've been updating our Excel expertise here as well. It is crucial. Patty, I'm going to skip your first question because I think we answered that already in the last one. But next question from Rita, I think this is a question around some of the algorithms we may have mentioned with Citymapper and Salesforce. I guess she's asking for your opinion about the biases and institutional racism that are being associated with some algorithms at the minute.
Yeah, you hear about this stuff coming out, and sometimes it's like, how did that happen? Sometimes you kind of, okay, who's creating this, and how are these kind of set? If people are like a certain kind of person, a lot of white men involved in tech and data, and yeah, like we've just got to be kind of ready for this question when you're dealing with algorithms. I don't do too much with them in my small charity, but like I hope in the future we can. But we would always be kind of thinking, is there something going wrong here? And you know, there's going to be, we need to embrace not turn against using technology, but making sure that these things are fixed, because I believe they are fixable. Like I think the problem is when AI learns, like, you know, what's the most common way, and that obviously misses out a lot of other people as well. So just probably being aware of that.
Well, that's it. If the people who are building the AI models are acting in an appropriate way, it's not the models of the AI itself, is it? It's the people that are behind it. But absolutely agree. Rita, I would actually really like to talk to you about this on a separate matter away from the webinar, where we could maybe collaborate on something else. So if that's all right with you, I'd love to pick up with you after the fact. But we'll be in touch separately about that. Moving on, next question from Heather. You mentioned collaborating with different NHS branches. Do you think this would be a feasible activity for smaller charities which provide similar services but are separate organisations?
Yeah, so for us, we're NHS Charities, and we kind of had some of our own funding from when we were created, when hospitals turned from private to public and they had money left over. And we kind of fundraise in our local areas. So we're quite, we didn't have any competition. So sometimes that's an issue. Some people don't want to share data if there's some competition. Though I do think that kind of view is sort of changing a bit, which is good. So I do think that this could be done with lots of other organizations. So worth looking at like NPCs, Inspiring Impacts, shared measurement, work on that. There's loads of like reports and things like that. Sometimes I think in the past it has worked well with like local groups, so, you know, Mind Network, making sure that they're all kind of collecting the same kind of data and sharing that. You're thinking about these kind of umbrella bodies or similar organizations when you are maybe fundraising locally and there's nothing in the way. I think because a lot of charities do a lot of the same thing in different areas, and obviously you have to be bespoke and there's a lot of innovation going on, but essentially we are doing similar things. And if we can kind of learn from each other, benchmark against each other in a kind of a trusting way, not a way that we're better than you, or we have to hide this now. The future is all about sharing data in terms of what we're talking about today. And I think the more you do, the more you get back from it, as long as you do it in a safe and useful and a way that can be compared, really, not just putting your data out and
I love that.
Smart way.
Yeah, absolutely love that. Where all about collaboration. Charity Digital, we're all trying to do the same amazing stuff. A lot of us at the end of the day, and we should be looking to help each other. So I absolutely love that. Patty, I'm going to try and ask you a question, although I'm not entirely sure of the context, but I will see if Oliver knows. The question is, the data storage options act like a CRM.
Yeah, that's what I was kind of talking about. Yeah, like a customer. What's the stand for again? Customer relations management tool. Salesforce, FlexiGraph.
All the other ones, Blackboard, all the rest. Yeah. No, great. Thanks very much. Question from Sahil. What platform did you use to digitize the data collection from service users?
So I think I was talking about kind of like we did use paper surveys in the past, and so we kind of just found a way to go to make SurveyMonkey work for most of our things. And there were some challenges and some successes in doing that and getting people more used to it. We also had things like QR codes on our artwork and things like that, which we're trying to make work as people are getting more used to QR cards with like your test and trace and all that. So people know how they work now, where before I think it was a bit of a mystery. Yeah, like it's basically just trying to get rid of that paper or like the tough ways of typing up things in spreadsheets and find a better way to do it. We also use Rike, so IEKE to collect a lot of data, which is like a nice smooth way. Menti is also kind of good for collecting data as well as sort of presenting and stuff. If you want like a quick kind of fun way of doing it. And if you haven't got SurveyMonkey, there's Typeform, which is really good. Google Forms, and that's always free and you can always download the data.
Yeah, great. Yeah, there's a plethora out there, isn't it? It just finding what you need to suit yours. I think you can get access to Google as well as SurveyMonkey and Typeform through Charity Digital as well. Shameless plug number 2. But yeah, do get in touch if you want to.
Yeah, and I guess it's using more technology as well. So we have a lot of you can, for example, if I did an interview, I might use technology to type it up to transcribe it for me. Maybe there's some other ways. If you've got a lot of data, think about what you could do, a lot of written data, and you want to digitize it, think about what other people are using, what you might do in your own life, for example, things like that. That's
really cool. Yeah, that's really, really useful. Yeah, we've done that previously as well. We use Rev, who actually provide the closed captions to this, also do a transcribing service. So if you're doing any sort of interview-led data collection or even focus group-led, that's all potentially online at the minute. Yeah, that's a really good point. Actually, you want to cut some time or save you some time on the transcribing, that's for sure.
I think there's always, if something's a hard job, there's probably an easier way out. Someone has tried to solve that in the past. So yes, if you're having a hard time typing up stuff, there's probably a better way around it.
It's always worth a Google, as I say. Yeah, just Google, see what comes up, and there's probably a solution out there, whether it's free or otherwise, that will be able to help in some way, shape, or form. Moving on to our next question. Do you have training recommendations for small charities using Google Analytics, or a good place to have a look?
I think Super Highways did something on this. I think that's something to look up. Just trying to think specifically on Google Analytics.
I know Google themselves have some really good stuff.
They want people to use it. I think we did get some help from, we did Google Ads. So, getting your search terms higher up when people search specific things. And we had someone, a consultant, help us for free because people do pro bono. It's part of Google for charities. And they're really helpful with all of that, really.
Yeah, exactly. Yeah. No, I think I learned way back when was trawling through the Google pages that they've got on analytics and ads and everything else. So that's often a good place to start. There's also some really good organizations and companies out there as well who talk really well to this. Super Highways are awesome. I know Access Group as well talk really well on Google Ads and other things around Google. So yeah, and we obviously have a ton of stuff on our site. So useful search in there as well.
Yeah.
Um,
Yeah, put it in the chat if you've had good experiences somewhere. I want
yeah,
to do more as well.
absolutely. Next question from Maruf. Impact report on both service and pandemic on service is an important topic in fund and bid applications. How can we produce it?
Yeah, so I don't know. I guess you mean, how do you do some evaluation of what you've been up to? And I guess, if you've already been doing a lot of it, evaluation is something you have to think of beforehand, which is annoying. But you kind of need to kind of know what you want to achieve and then kind of find out how best way to do that. But saying that, there is some stuff you can do looking back. So I'm sure you did collect data when you were doing work, wherever that, like I said, it might be postcode data, like in the example, it might be, you might have even logged, times, you might just have the timestamp on things from when you heard something and you provided it. That's some like quick kind of data you could do to work out how long that took. And did that get worse? Did that get quicker? That might be something you could report on. You could always do, obviously, like a retrospective survey. Obviously, those things are not as robust as some other forms, but like you just sort of try to do something. I think it's better than nothing, just to kind of like, if you have like the time to do it, good to make time to do it. Anything which kind of creates learning discussions, really, because I think that's the key thing, which would probably help you, getting your team together, having something to talk about. If you had a survey or something, like, is this right? Is this comment correct? What can we do to improve that? Always linking it to that, really, I think, in your specific example there.
Thanks a lot. Our next question from a good friend of ours, Charity Digital, Pauline. Hope you're well. The funders data on 360 Giving's grant nav is open data. Would you encourage charities to publish our data as open data? And if so, how would you recommend that charities do that?
Yeah, don't know how to recommend that, but like, for example, we like the shared measurement project I spoke about. That's something we'd want to do more, and that actually encouraged us to do 360 Giving ourselves with our grants. But on our charity work, I think we need to find a way to share as much more data than we do, but it's just finding out what's the most useful things to share. I think with money, it's quite simple. If we're thinking about charities, is it kind of, number of volunteers, some of the stuff is already collected in your accounts and things like that. But is it more the other level where you think about impact data, outcome data? And then that's obviously a bit more trickier, because we have to make sure that we're comparing the right thing rather than counting things. And yeah, I hope we do more. Yeah, I don't know if you've got anything else to add, Chris.
No, that was great. No, all in there. And final question, it's a follow from Patty. Is there a one in all, out of the box sort of data storage system where you can store file, contacts? It's a CRM, it has email, chat, it has calendar, it has surveys, that works well for all charities. I mean, I'm going to go out on a limb and say no, because it's just each charity is so different in what they're looking for. But is there something you've seen that's close?
Well, like, the Microsoft suite, like, I think a lot of us, sometimes I've been working somewhere, we have it, but we don't really use it. We just use it for like the Outlook. There's kind of a lot of stuff you can do on that, or you can integrate a lot of other tools with that. So, on Teams, you can get more of your kind of data connected to that with all your other things. But like, not all things are done best by the same thing. I think that's fair to say. Like, it's best to find what works best, but obviously then trying to stick with that option once you do find out. For example, like for surveys, like if you SurveyMonkey we use and we like, but it can get costly. For example, you might want to spend your money on a good CRM, but then save your money on the surveys and go for Google Forms or something like that. So I haven't got one specifically to recommend, but if they do exist one day, that would be great.
I think it's spot on. I think in a minute, as it stands out, it's more an amalgamation of the things that you require most, isn't it? It's connecting your CRM with the right automation platform, with the right email platform, and having a suite. There's some that do a lot, but not all. And usually there's always a way to try and, there's always you always want to make it a little bit different to what it is out of the box as well. So there's always a bespoke element, which is what you might be missing. But that is it. Spot on 3 o'clock. That's all we've got time for. I just want to say a massive thank you to you, Oliver, for your time today, and thanks for joining us, for sharing incredible insight with everybody. Thank you very much. And thank you, of course, everybody, for all turning out today this afternoon a little bit later than we usually do these things, and being so engaged and being so chatty as well. So thanks very much. Coming up next, later on next week, 2 weeks from now, sorry, August 24th, we have a live demo of some cybersecurity tech in action. We're bringing this to you because we feel we all need to be a little bit better protected at the minute, given the fact that we're all more vulnerable than we've ever been. Following that, we have our next webinar, which is taking the learning from this year's Charity Digital Skills Report and putting that into action. That'll be on August 26th. We're following that on September 9th with a self-defense class, how to sort of equip yourself with the cybersecurity tools, tech and skills that you need, again, to go into a much bigger fight that we're seeing is required for cybersecurity. You can find all those and more in the event section of our website. And while you're there, don't forget to check out all the amazing content and products that we have there as well. We will be sending the slides and recording out in the next week, as I said at the beginning, so keep an eye on your inboxes for that. And we do send a feedback form straight after this as well. So please take a couple of minutes to fill that in. That really helps us to keep on improving this webinar service for you, and also gives us ideas for good topics to bring to you going forward as well. But that's it. Thank you again. Thanks again, Oliver, and we'll see you on very soon.